Okay, thank you. Yes, here I'm going to present the Bangladesh paper. Actually, as Santiago said, that is a part of this project of the 9 country papers. Uh, so, though there are limitations, there are a lot of limitations. I'll be talking about those things in the presentation and also in the paper quite a lot. But still, social protection appears as a key policy domain in Bangladesh. It's in the discussion, it's very much there. And whenever the budget is announced, annual budget, national budget is announced, it has always been discussed after that, what percentage of GDP or what percentage of budget has been allocated and whether there has been some improvement in the social protection system. But it is also, we have seen there has been an evolution from emergency relief to structured program over the last 50 years or so, especially Bangladesh. You know that it came out from a very devastating war in 1971 and with a very high level of poverty incidence, close to 80% during that time, early 70s. And then the social protection program at that time was related to very much emergency relief. But then over the last 5 decades, it evolved. I'll talk about the current challenges, and then more importantly, there is a kind of very structural shift in this whole outlook or discourse in social protection in Bangladesh, especially with this introduction of this National Social Security Strategy in 2015. But there are serious implementation hurdles. I'll talk about those institutional and political economy issues. And I think I'm not really going to talk about the objectives of the paper because I think these are very much common across all the 9 papers. So when we see the scale and the reach of the social protection programs, there are insurance programs. Like many other countries, we have these contributory pension schemes. And the contributory pension schemes is primarily focused on the government employees. But in 2023, or 2022, I would say, the government started talking about it, and then in 2023 started implementing it or introducing it more widely, is the universal pension scheme. And under that universal pension scheme, they also allowed the private sector employees to join. But so far, what I have seen from the data, that the response has not been that great, especially the participation from the private sector and various others. So there are 4 schemes with these universal pension schemes, and they are not really great so far at this moment. For example, there's for private sector, for citizens even residing abroad. There are for self-employed citizens, and also there is one scheme for the low-income people. The health insurance is again very much private, not very public, and also with a very high incidence of out-of-pocket health expenditure. It's close to almost 75% or more than 70%. It shows that the kind of the weakness in this health insurance area. And then there is also employment and disability insurance. The scope is also very, very limited. In 2022, there was one pilot scheme was introduced for 5 years in the ready-made garments industry in Bangladesh, which is, the most vibrant or most the kind of premier sector in Bangladesh. This is the 2nd largest exporters of ready-made garments Bangladesh has become in the world. But then because of, that there are many accidental, occurrence which happened, especially the Rana Plaza, which is the infamous one in 2013. And after that, there was a pressure from the donor community to introduce this kind of insurance scheme, accident insurance schemes in the ready-made garments sector. So with all these efforts, and after almost a decade in 2022, then there was this introduction of this pilot scheme for 5 years, but that was with the money from the donors. So employers did not really contribute to that. So this 5-year scheme is going to expire in 2027, and then there is no, guarantee that this will continue. This will be continued because the owners or the exporters, they are not really buying this kind of insurance scheme because at this moment it's running because it's fully donor funded. So now there are also, I think, the more importantly, the focus of the social protection programs in Bangladesh is actually mostly the redistributive programs. There have been some targeted programs or target transfers. For example, old age allowance is the most prominent one. There is allowance for widowed or husband deserted women. And of course, later on, it came the conditional cash transfers, which are linked to education, linked to some other, especially improving maternal child health, nutrition. And that really became a very prominent redistributive program in Bangladesh. And there have been many empirical studies looking into the impact of these conditional cash transfer programs. Food security programs, it started with this VGF, the vulnerable group feeding, after the 1971 war, but then it evolved to vulnerable group development later on. And that's the kind of a structural kind of development, especially to incorporate some of the other developmental aspects, not just feeding. But there is also a program, it's called Food for Work. And also government time to time spent money to kind of subsidize food, especially during the time of high inflation. And at this moment, over the last 3 years, it is very high inflationary phase the country is going through, where government has, through its one institutes called the Trading Corporation of Bangladesh, it sells food stuff to the low-income households at a very subsidized prices. Very quickly, if you look at the allocation of the social security budget, you can see that the large chunk is actually go to the elderly, the old age allowance, and then targeting the households' poverty situation or poor households. But there are also several other kinds of social security programs. In terms of the beneficiaries and the poverty incidence, in general, it shows that though in the urban areas, there's kind of significant poverty incidence in some of the urban areas, but the coverage of the social protection program in the urban areas is relatively lower. I think this is not very unique in Bangladesh. It's probably in common many developing countries because of the problems or the challenges in targeting the urban poor people, because many of them are floating population. But still, I think that remains a big challenge. Just some quick analysis using the latest household income expenditure survey data. It shows that out of these total beneficiaries by gender distribution, it sees that it's kind of evenly distributed, and the female, they're getting a little bit higher percentage than the male. And also it shows the pattern is consistent across different age groups. It shows that the female, they are having a little bit higher percentage in terms of beneficiaries than the male. In terms of the income group, it also shows that, I think in the last presentation also showed that in Honduras, the higher income group, they're also receiving some social protection. It is also very much there in Bangladesh. You can see that the fourth quartile, 8.6% of the people or the people living in that quartile, they are actually receiving some kind of social assistance. But more importantly, I think quartile one, and just to tell you that the poverty incidence in Bangladesh, the current rate, it shows that the extreme poverty rate is around 10%, and the moderate poverty rate would be around 25 to 30%. But again, there is a high degree of vulnerability, because if you adjust or make a little bit of upward adjustment of the poverty and income, we'll see a large chunk of population falling into poverty. That means that poverty rate is not really very stable poverty rate. And that's what we have seen during COVID, during this high inflationary phase too. In general, this slide also shows that the urban, though there is a rise in the percentage of beneficiaries in the urban areas, but still compared to the rural beneficiaries, there is a significant gap. Now, as I said, I talked about this historical evolution. I talked about the movement from or shifting from the relief program to more structured program. Then this is the kind of the steps through which the social protection programs evolved in Bangladesh. Started from very poor relief approach, then there were disaster response and relief to development, different kinds of programs related to that. And then there were social protection for special groups, especially related to when it comes to the targeted the conditional cash transfer or social protection programs for women, different kinds of women groups. So that is very much there. But then the whole discussion actually, it came a little bit, I think later in 1990s and early 2000s. about this whole graduation approach. I think that also, that the discussion or the discourse also was very much benefited by many empirical studies which were taking place outside of the government domain, especially run by bigger NGOs like BRAC or different other NGOs, who are also spending, or who are also working with the ultra poor program, and they're trying to emphasize on this graduation. That means just simple cash transfer or simple kind of social protection assistance is not enough. In addition to that cash transfer, there were initiatives to help with different kinds of skill development and various other assistance programs. But as I said, there was a structural shift in the whole discourse, is that the formation of the National Social Security Strategy back in 2015, or exactly 10 years before now. So there are many government agencies or ministries, they are responsible for different kinds of social protection programs. At this moment, roughly 140 social protection programs are run by more than 25 ministries. And there is serious allegations of multiplicity, duplication of programs, and then overlappings of several programs run by one ministry, and then there are other ministries that are also running almost similar programs with different names. So that means there is a serious need for kind of harmonization of these whole programs. As I said, I have already talked about the role of non-state actors, especially I talked about BRAC, but there are several other NGOs who worked on charity-oriented programs, provided different kinds of development services. For example, BRAC, they started with this informal or semi-formal education or different kinds of health services at the rural level. And then also different kinds of participatory NGOs, and also targeting how to empower women, through different kinds of microcredit programs. So these are also, we have seen this kind of non-state actors very, very prominently in Bangladesh. But more importantly, of the last 1.5 decades, we have seen geo-NGO partnership, especially many of very important social protection programs of the government. They're also being executed with partnership with the BRAC. So I think this kind of geo-NGO partnership has come out very strongly. In terms of laws and regulations, two things just to highlight. One is that the constitutional provision is very much there, in like many constitutions of many countries. So all the nice words are, universal protection system or health and education, everything is there. But apart from this National Social Security Strategy, which came out in 2015, we don't see any other laws and rules and regulations talking about this kind of social protection programs. The budgetary allocation, this has also been heavily criticized, especially when you look at the percentage of budget, around 15%, or percent of GDP, around 2-3%. But again, these are overinflated or overestimated, because when you talk about, as I mentioned about the high incidence of poverty rate, when you talk about the social protection programs, especially meant for the poor people, and if you exclude the share for pensions, and also there is national savings certificates where government also subsidizes the national savings certificates with respect to the interest rate, that interest subsidy is also being included into the calculation of social protection budget. So when you exclude that, actually the actual amount or the percentage of budget which is spent on the poor people, it comes down to around 8 to 10%. Whether overall it's around 16%. So you see that kind of gap which is there. I know I have little time, but very quickly, this comes from this National Social Security Strategy 2015. They identified these three columns of, in terms of when it comes to the social security financing. The types of instrument, it can be social transfer, social insurance, labor legislation, and then we see the financing, just 30 seconds. And then we see that there are different kinds of social protection programs you can categorize into that, but there are serious challenges related to the financing, as I mentioned earlier. Very quickly, these are the serious institutional challenges. I think these are also need to be discussed in the context of Bangladesh and a low or lower middle income country, where we have serious fragmentation and coordination deficits, weak implementation, inadequate legal and regulatory frameworks. I have already talked about. Data issues is a serious issue problem. Capacity is a big problem in terms of implementation, and we have seen the ineffective use of digital platform. My last slide. We have also seen a huge political influence. When the government changes, especially at the grassroots level, the selection of the beneficiaries, there are allegations of the political influence over those selection of beneficiaries. I'll stop here. I had a couple of more slides, but I could not finish.